Like and subscribe right now, or else this will be in your bed tonight. Doctors of Reddit, what patient made you go, how the f are you even alive? We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented, and we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s. He was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 AM and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile, he's so coherent and alert, as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious, or would already be dead. They swooped him off to surgery before he could contact his wife, and the dude lived. Remembering that story got me through a lot of tough years in the year, because I think it just reminded me that hope and good outcomes are still out there. My favorite bit about this story is you called someone in their late 40s back quote a young guy. As feel good as this story is, you've just made a bunch of other random people very happy. When I turned 30, my little brother told me don't worry about it. If your life was a Wikipedia article you'd still be in the early life section. That actually helped a lot. I'm a poor college student, but this comment deserves an award, so here you go. Edit. Forgot/deleted an article. Imagine my surprise at learning that at 34 I'm not old enough to be considered a young guy yet. Your 30s are definitely your late teens of adulthood. Enjoyed, my friend. Lady in her mid 30s was in the clinic for a 1-week follow-up post-foot amputation. Diabetes. She was admitted straight from the clinic because her blood glucose was 600 mg/dl. Normal is 80 to 120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64-ounce sodas and candy bars into the hospital, literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of how the f did you survive that trauma/disease, but how the f do you even function on your own. My wife's father died due to diabetes complications. He'd been in and out of the hospital for several years. He went in on a Friday. They amputated toes on Sunday. He was dead on Monday. Nobody was prepared, but nobody was surprised either when we went to his apartment to clean it out, and there was candy everywhere. Under couch cushions, pillows, in his bed, in all of the cupboards. I have a sweet tooth and I can't imagine wanting this much candy. The man killed himself. I can understand how people keep eating sugar, even after they lose a foot. I understand people get addicted to food, and addiction is a horrible thing, and that sometimes people just have a f it attitude. I can get my head around that. What I don't understand is how the kids can bring in sugary food after seeing what it's done to their mom. Absolutely no way is anyone I care about in that situation getting anything remotely bad. When my dad had his heart attack, which the doctor said was mostly down to cigarettes, there was no way we'd let him touch another cigarette. Not that we needed to. That was a massive wake-up call for him, and he took it seriously. But if he'd asked for us to bring some to the hospital for him, me. What the hell went through those kids' heads? My Phil almost died from long-term alcoholic damage to his liver about 7 years ago. He was in a coma in another state and my husband took time off work to fly out and say his goodbyes. He made a miraculous recovery, but was told no more alcohol. He moved to our state last year and my husband will buy him bottles of liquor and go out to drink with him. Whenever I asked him why the f he would do such a thing, he can't give a straight answer. From what I can gather, it's about making his dad happy in the short term and hoping that reality doesn't real. I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. The duality of man. One of these men ate his vegetables. One of these men drank his milk. A friend of mine had to get his entire leg amputated because he slipped off the bottom step of a ladder and bent his knee backwards. It apparently pinched some type of main blood vessel as his entire leg eventually got necrosis. When they had him in the hospital, they tried to helicopter him to some other hospital, but there were high winds, so they had him sitting there with the necrosis spreading over a stupid 1-foot slip. During residency, my IQ patient had to have his chest reopened less than an hour after 6-hour open heart CABG surgery. He needed 12 units of blood, his heart massage then shocked 4 times. Cardiothoracic surgeon and the IQ operating, because no time to go back down to or, was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 we had to consult and to take maggots out of his nose. I was sure he was a goner after that. Week 3 passed, no change. Week 4, day 24 I believe, at 6 AM, he opens his eyes. I was shocked. He has a permanent tracheostomy now, but somehow is alive. How the hell did he get maggots in his nose? I'm not that poster, but I'd assume drug abuse. I shadowed an SLP and an IQ one day, and we had to do a cognition eval on someone who had overdosed on what his chart called a variety of drugs. I forget exactly how I found this out. I think he was alert and told us, but he'd done so much cocaine that he didn't really have a soft palate anymore. It had just dissolved away or something. I'm really not acquainted enough with drugs to say for sure. Edit. Remembered it wasn't a cog eval. He had been intubated, and we were doing a speech/swallowing screen. A guy I took care of during my residency. F***ing cyborg. I was the chief on trauma. Got a page about a patient en route with a stab wound to the chest. When the patient rolled into the trauma bay, he had no pulse. He had been stabbed in his left upper chest, 3 centimeters below clavicle. He got an thoracotomy. If you want to feel like a badass, then do an thoracotomy. We were able to cross clamp his aorta. We took him right to the OR. We oversewed one small artery below his rib, then transported him to the IQ still intubated. 8 hours later he was extubated and wanting breakfast. Seriously, dude, he was dead 10 hours before. He was also a complete a**hole. No wonder someone stabbed him. Nurse turns to the doctor. Can we unsave this one? Where's the unsave button? The neck. Gotta give it a good twist though. My dad is 87. He had prostate, liver, bowel, colon, and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands. Every year he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. If I were a doctor or scientist every 6 months, I'd want to see this guy weekly so I could study him and give other people his immortality. I don't know man. If immortality comes with those side effects, I might pass. As a med student on my emergency rotation I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head, essentially door, and we couldn't get a blood pressure when he got to the hospital. As a student my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CORT scan we got. I figured he probably wouldn't have made it, but about a month later I'm now on my IQ rotation and I see this guy awake and conscious. Pretty crazy. Any update on his condition? Crazy. When I saw him, we were basically seeing how much function he would get back, but he was going to be in the IQ for a long time. From what I can remember he couldn't really move either leg, but he actually had some movement in his arms/hands, so they weren't sure how much he was going to get back by the time he left the hospital. My mom's a doctor. I asked her about this when it came up on Reddit. When my mom was in her IQ cycle during internship, man with police officers behind him came in the IQ. The man was perfectly fine and walking, so my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece, which was a car. It didn't look like a car at all, just metal trash. The officers told my mom and her colleagues that they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine, and got his name around the hospital for being immortal. Thank you very much for watching. In the comments under the video, write something on this topic, and also do not forget to watch our other videos. Bye.